All right. Um, so Anna, feel free. I know you're not on the committee, but feel free to jump in with your thoughts and stuff when we're chatting. Um, the way I kind of envisioned this was, oh, sorry, let me introduce myself because of the recording. So sorry, I'm Jennifer. I'm the membership chair. And we're just having a panel discussion about how things went at FNCE, what we took away, what were, maybe thoughts about what can come up and things like that. So the way that I envisioned this was a kind of going through the different parts of it. So I thought we'd talk about the dinner first and then the showcase and then, either sessions or what we want to do moving forward and stuff. Does everybody else want to introduce yourselves or do you want to just jump in?
Well, I'll introduce myself, Jennifer. Hi, everyone. Hey, I'm Jean Daniello. I was at FNCE. I was sponsored. I was appreciative, and I'm trying to be the IDD support specialist, and that's it.
Um, I'm just going to go down the line. Y'all can yes or no. Teresa, do you want to introduce?
Sure. Yeah. I'm Teresa. I'm the event chair elect, and I was at FNCE participating in all the events we're going to talk about. So I'm excited to do that.
Awesome. Mackenzie?
Hello, I am Mackenzie Harris. I am the current BHN chair. It's an honor and privilege, and it's been very fun to learn from and with this lovely group of BHN EC members. And yeah, I'm excited to chat a little bit about FNCE. FNCE is my favorite event of the year, so excited to chat.
Awesome. Jennifer?
Hi, I'm Jen Hafley, and I'm the nominations chair. And what else am I saying?
That's fine. Or just introduce yourself. If that's enough, that's enough.
All right, that's it.
Awesome. And Jessica, are you able?
Yeah, sorry, I'm in a car, so
No,
I'm
you're
not going to
fine.
turn on my video. But my name's Jessica Steinbach. I am the eating disorder resource professional. And yeah, I was also at FNCE and excited to be here today.
Awesome. And Anna, if you are interested in introducing, you can go for it.
Sure. My name's Anna LaFoon. I'm located over here in Springfield, Missouri, and I work with the Arc of the Ozarks. I'm new to the group, so yeah, just kind of immersing myself and getting to know everybody and all the resources that are available online. So,
Awesome. Thanks for
yeah.
coming, Anna. So like I said, I was thinking we'd go down the line from our event. So I wanted to talk about the dinner first. So Anna, that's where actually I think those of us that met you at the dinner, right? So if anybody had any strong opinions about what went right, what didn't, maybe that we could have improved on if they're like I felt like it went really well. Even the technical glitch that we had was funny and not a problem, So I thought it went really well. I liked the presenter. Felt like she was very knowledgeable. Do y'all have any thoughts, adding anything like that?
Yeah.
Well,
Oh, you go for it, Jean.
I just thought it went very well. It wasn't a huge group, but everyone interacted a lot, so that seemed to me to be more beneficial actually, and it seemed like a very good group of interested people. So that's all I would say. And the speaker was wonderful. And I think it went well. From my perspective, it went well.
Did anybody hear any feedback from attendees or Anna? Maybe it would be interesting to hear from your end that wasn't involved in the planning and putting it together, just on the outside perspective, if you thought everything went well or if it felt helpful.
Yeah, sure. Honestly, I was very impressed by the dinner. I really enjoyed it. I thought it was a lot of fun. Um, and yeah, I thought the speaker was great. I think it's kind of it was nice having a little bit of a different perspective of like health and wellness coming in and just, I don't know. It was great. I
Yeah.
wouldn't change anything.
We'll have to message her and tell her everybody really liked her presentation if we haven't already.
I for
But
sure will. Yeah.
say that again.
I'll for sure tell
Yeah,
Jana.
sure.
She absolutely adored it. And I really liked having on the first night. I don't know, Anna, is this your first FNCE? Or like have you been to other FNCEs or other dinners at FNCE?
I've never been to a dinner at FNCE. This was my second FNCE.
Okay,
My first one, I was still a student, so
pretty
a
cool.
little bit different perspective.
Yeah. And the reason I ask is that we've someone correct me if I'm wrong. I feel like we typically have it on like the Sunday or the Monday. Like it's usually like a little bit later.
Further in, yeah.
But I really liked it having it on the first night. I felt like it was like a good little like launching for the week, and then we could like kind of see familiar faces. I saw like familiar people at the dinner, like walking around like at the different mental health talks and stuff, which was kind of fun. So
I'm curious if any of y'all think if there's a takeaway in your own practice from the presentation. If anybody has ideas of how they're going to incorporate it, or if you already have anything like that.
well, we have a resident yogi in this room that I'm like so sad that I didn't know this before. But like not to pick on the spot, Jennifer, but Jennifer's like a big deal yoga girl. And so I'm sure that you put it in practice. I would love to hear your thoughts on it, Jennifer, if you like have things that you would add to it because you're like so knowledgeable on it. But I actually cringe with yoga. I learned that I need to be like more open to it. And like a lot of what she was saying of like your clients might be hesitant to it because of like sitting in their body and all that kind of stuff. Mine's more for just my ADHD self. Like I'm a little bit
I say that all the time. I was like, I love the idea of yoga. I love the research behind it, but like actually doing it for me, the only time I've ever been able to do it is weirdly, I think my brain is quieter when I'm pregnant. So both of my pregnancies, I could do it. But yeah, I see the benefit and I believe people when they say it's there. But for me, I don't know. It just it doesn't work. And then I'm told I'm doing it wrong, which doesn't help either. But
See,
yeah.
mine's like the shame of like I'm not good at this and I like being good at things. And so like I just am embarrassed because I'm like I should be good at this. I should be so mindful being in this field. And the fact that I'm like having a hard time doing this is like so embarrassing that I'm like
Yeah.
like I'm an Enneagram 3, so like I get in like my shame cave and I'm like I should be good at this.
I've
Oh.
found I have an app. If any of y'all, I think some of y'all have heard me talk about it. Nerva does self-hypnosis therapy. So it's gut directed self or hypnotherapy. And that works really well. I don't know what the difference is because it almost sounds like a guided meditation. I don't know if it's mindset going into it or whatever, but yeah, no, I'm right there with you, Mackenzie. Sorry, Jennifer, I know she was setting you up to talk and then I took over. So sorry.
Well, as an Enneagram 1, I'll tell you why I'm offended and why that was wrong. I'm kidding, 100%. I thought it was good. I think my reflection, just being familiar with Jennifer's course and also having taught at the partial level for a bit, their yoga group, is thinking more about how it can be implemented as dietitians and clinicians rather than through a specific yoga focus. So one thing that was really helpful to me in the way that I practice that I learned from the yoga training that I did was a bit of giving people that permission to letting their mind wander, to inviting those thoughts in and reflecting, what do you think that's telling you? Like, where are you noticing that your mind is going so that we can maybe talk about that and reflect on that? How are you feeling when you're thinking about that? And having that intersection be a little bit more present and maybe doing that in session compared to a bit more of like that when you're on the mat focus.
I love that. And also while I have you, first of all, hi Kendall. Thanks for joining. It's good to see you. This is
Just type in,
for
yeah.
those who don't know that she's the girl who planned all of the things.
And then she missed all the nice things we said about how well the dinner
Yes,
went.
we all loved
I
it. So
know. I got stuck on a call and I was just like, it was a lot of food questions there, so I was cool.
okay.
Here I
Yeah,
am.
no, we're just catching up on the presenter and like the presentation and all that kind of stuff. But we were talking about like just the application of the yoga stuff in practice. And okay, Jennifer, I'm sorry, I'm keep putting you on the spot. I don't feel like there is a natural cadence for me to be like, so 24-hour recall, and now let's sit and be mindful. Like it feels so awkward to go from like, so like walk me through your week, and then it's like, okay, now we're just gonna pause, and it's like it feels so awkward. I don't know, and like I'm in the private practice setting, and I feel like it would be even more funky in like an inpatient setting. I don't know. I
Yeah,
don't
yeah.
know like
So
how you would do
for
it.
me, it's not something that I think I would use all the time, but for instance, I got on a call one time and she got on the call while she was finishing up a phone conversation and she looked a little stressed, but she like took a big breath and calmed down and then went straight into a panic attack. We did not have a session other than I pulled up a guided meditation, like stress anxiety thing for her, and that instance and just like, why don't we do this together? Why don't we? And then she calmed down and we ended the session. So that was all we did that day. But I would think it would be more organic. Like, if you, especially the longer you've worked with an individual, the better you are at picking up their tells that they're getting to activate it or to whatever word you want to use, that you can like, why don't we stop? Why don't we do this? Take a minute, even step off camera if that would do better. I think that would be how I would use it more than just like what you were, like, okay, let's talk about this. And then like, by the way, breathe, I don't know. That was how my thought was. I don't know if anybody else had any ideas, but in the clinical, like in a residential or like an acute like care hospital or something like that, I would be curious how anybody thought that would be able to be incorporated, I guess.
I've seen it as in groups and then bringing some of that to the table of like, well, think about what we talked about in group last week. This was our meditation. Is that a helpful thing to focus on? And I think the last thing I'll throw in there is just giving people the choice of whether they're wanting to focus, which is a lot more where like typical yoga that we think about. And I know I'm like familiar with, but my opinion is not the only yoga opinion that, can be included. But sometimes it is helpful to distract. Sometimes it is helpful to keep your eyes open. Sometimes that is the invitation of being on the mat at a higher level of care, or even in a session of let's not talk about food for a hot second. Let's allow you to be a person with other stuff that is going on in your life and finding that balance of when are you connecting? Like when are you feeling those things? And when are you giving yourself that permission to not be present?
I know. I feel like floor counselors in RTC facilities could really benefit from that. I almost said that chick. What was her name? I want to use her proper name.
Gianna.
Yeah, I was like, it was a J.
That chick. She would respond to that chick too.
But she really should market herself to the treatment centers because the floor counselors could really use some support in distress tolerance and supporting the patients with that. I can think of a specific scenario where as a dietitian, I was sent to train a robust amount of floor staff that just had a big turnover. And it was so clear to me that when a patient got really upset and tearful and went to the couch, and it was clear to me that no one understood that even something as deep breathing is something they could go sit next to them and do with them. And so as the dietitian, it was cool to model that for the floor staff, but it reminded me in this moment that like, yeah, I feel like we could do so much more of that in higher levels of care. I actually think it has a place,
Yeah, I definitely think the groups, so like even when I did inpatient psychiatric hospitals, I think that could have been involved more. But yeah, any of the places I've done a group sessions or whatever, I think that would be a good spot for it rather than having somebody be on the spot like, all right, I don't know. Awesome. So it sounds like overall pretty effective presentation. Everybody's really happy with the topic and awesome. Is there anything anybody else wants to add?
I think next year it'd be cool to get someone on trauma, like something that goes a little bit more advanced. I really liked it, but I do think it was pretty low level in terms of like advancement in terms of the intricacies of mental health and stuff. So maybe there's room in the next year to do something like on trauma in the body.
Yeah.
I don't know.
That was a thought I had today, not specifically that, but that it would be interesting to have someone come in and talk about like different counseling techniques and stuff like that too, so that could incorporate. As a side note, I am trying to work on a proposal for FNCE next year, and if my friend will agree, I'm gonna have a therapist with me, and she would be exactly what you're talking about. Her specialty is trauma. So if that is something that comes along, but yeah, I think something along those lines, maybe not specifically nutrition related, food related, but stuff like that.
Yeah, something when I was planning it and trying to figure out what would be a good topic, knowing that we can't provide continuing ed hours, kind of help guide that, the fact the rest of FNCE for most members is pretty CE heavy. And so that's one of the reasons I went with something a little bit lighter so that it wouldn't just be like, I've been learning and I can't stop learning and
That's
I'm
true.
tired of
That's a good
learning.
point. Yeah.
So learning fatigue. So that's why I wanted to do originally something that was like even more interactive. But I think that it came out really nicely the way it is. And Therese is planning next year, so you get to
Well, there you go. You can pick it.
you can pick it.
I'm
I
curious
support trauma. I love that one.
We all pick it.
I'm curious if anybody had any negative feedback about it. I think the only thing, and it's something that we're going to struggle with every time, is getting the networking with people that don't know each other more. I don't think that I like the idea that we did, but I don't think it ended up being as effective as we wanted it to be. Which, like, I think Kendall, you brought it up a few times. We don't want to like rip people away from their friends, but it is a networking. I wonder if calling it a networking event rather than like a reception might a little bit. I don't know.
I
We
saw
were
a ton of
talking, oh,
networking.
sorry, go ahead, Teresa.
I was just saying I saw a ton of networking happening outside of the sticks. So I think people are doing it naturally, but perhaps there are some people that have a harder time.
Yeah, that might be a thought, is how to support the more introverted in the session. I'm not great. I'm fine when someone comes and talks to me, but I'm not great about starting that, like that doesn't feel good. So,
So I have a weird idea. Someone might jot it down. And it's not too weird because we just did it. So just had another event for work a couple weeks ago. And it was with a diverse group of people from, that didn't all know each other.
Jennifer, yes.
And when they came in to this meeting at like 7 o'clock in the morning and were signing in or checking in, they were given like a little picture of like one of them would have Mickey Mouse, and then there would be somebody else that would be getting Minnie Mouse. So about 20-30 minutes after the introduction to everything, they were like, all right, everyone go try to find your match. And so, if someone had Bert and they had to find Ernie, so it caused people to walk around and talk, and they were it was kind of fun. And these were all like adults, like they're professional, they're all salespeople, so they do have more of an outgoing personality. However, I thought it was kind of cute and fun and very low stress.
We'll have to think about that more with planning.
Yeah. It was neat. And a dietitian put that one on too. It was kind of fun.
Awesome. All right. Well, why don't we move on to the showcase? What did everybody think? I thought our table was awesome, but I always think our table was awesome. I felt like we got a lot more interest from other DPGs than we did last year or any other year that I've done it. So the vegetarian DPG was super communicative, the diabetes. We need more P chains. Yes. We'll have to remember those things next year. Those were the hit. I got a hug because I gave someone a P chain. Like that was they were so popular.
Someone told me their childhood story about being called a little pea by their grandfather.
Aww.
I was like, what has happened with these P chains?
Awesome. Also, I love that P chains was like, it's cute, but also like a mishearing, misunderstanding of what was said. And it just like, we just went with it. It was, yeah. So, yeah.
I will say afterwards, and like I probably should have confirmed offline. I thought they were doing the discounts again this year. I was a little disappointed that I don't think they did them.
That I got that feedback.
I for sure thought I was told that they were getting discounts. Did I mishear?
I don't know if we just expected it from last year. The last 2 years.
For those of y'all listening, or the listeners
I
that
thought we were getting discounts too. And when I was getting up, I was like, where's the flyer? I don't know.
I thought there were discounts too. So I don't know what happened to that.
We need to push back on that, I think, because our joining rate for this FNCE was really low, and I suspect that is part of it.
Well, I also think, the attendance, even at the table and through that whole room, I don't think it was as big as last year.
Because I felt like it was a basement type feel. Like the lighting kind of stressed me out. I got a little bit of a migraine. I was like, this lighting is not great.
Yeah. I don't know. I felt like I was busy the whole time, but I also didn't. I think I went and got like a little fajita thing I made, but like that's the only time I stepped away from the table, so I didn't really see the rest of it. Like I felt like I talked to a lot of people, but yeah.
It also felt like a lot of the people at the tables were people who were at other tables, if that makes sense. Like it wasn't a lot of new member perspectives. It was people from other DPGs.
Do we
Yeah,
know?
I talked to people like afterwards. I went somewhere else and talked to some people, and they didn't even know it was happening. So I think that maybe it was so far away from where the actual conference was
Yeah.
occurring that
It
people,
was.
if they weren't staying at the Hyatt, why would they walk all the way to the Hyatt? And it also, on top of that, they may not have seen the notice, or they saw like, Expo, Hyatt Expo room. That's confusing when the Expo room for the whole thing was in the other place. So I think to me there was some confusion there on my part when I first saw the signs. It didn't make sense.
Yeah. I think
I
it's
walked into
always
somebody's
been,
I,
wedding
yeah,
setup. So
it was really too far. I mean, Forrest did not make it,
yeah.
and it definitely wasn't accessible
Well,
for
and
for
also
the.
in addition to that, remember there was like that drama outside as well with the police presence and stuff. So like I don't know how
Yeah.
much that impacted, but
Do we
um
know if FNCE as a whole was attended well? I don't know if I ever got a clear answer. Like, was this one like as well attended as previous FNCEs, or?
the expo seemed huge compared to the others to me, and it was still crowded. So I don't know. I mean, that's just my perception. I don't know what the actual numbers are. I haven't heard.
Expo was huge, and it was crowded. But people can sign up just for the expo. So I don't know. It would be good if at least
Yeah, I want to get confirmed numbers. I just always felt like Orlando was the biggest one, I feel like in my brain. I feel like Orlando was pretty massive.
Is that the
Uh,
first one that we did though, right? As that we all did it together and we were, yeah, none of us knew what we were doing or what to expect or but awesome. Any other takeaways? I think that one thing I definitely caught from it is that we need to, especially the ones that particularly came and asked if we can do some joint education or office hours with vegetarian and with diabetes, just because they do seem interested when we get into however we're setting up the education webinars and stuff like that. We did just do, Forrest just did his last office hours with diabetes. Can't remember her position in the role, but she was involved in that one too. So, any other takeaways from that? Tabling, I mean, everything on the table I think went well, right? No, I didn't expect this to be a big conversation, so I just wanted to touch it. What about the sessions? Did anybody have a major takeaway or like notice any patterns? Had a really good, really bad session? And Anna, feel free to jump in.
you know I thought some of the sessions that I attended were really excellent.
Really good.
Um, yeah, and it has nothing to do with BHN, but I went to the lymphedema and lip, lipema. Um,
Lymphedema and lipedema.
yes, exactly. And you were there, Jennifer, but that was outstanding. And they had a lot of people in attendance, and they answered a lot of questions. It's not a topic that's talked about very much. So it
Yeah.
was kind of a great topic that they presented. And
I feel like I'm hearing a lot about that topic, like just around, that it's getting more attention.
was that your favorite
well,
one, Jean, or like what was your favorite one? I didn't go to too many, unfortunately, but
Yeah.
I just
well, I was between that and the oral health. The dental health was also very relevant and it was very interesting. And I'd never had a chance to get up close to different um, implant and prostheses of dental. They brought all these things that you could look at, pass around, and gave very good information out at that presentation as well. Those are the two that really stand out for me.
Awesome.
Um,
Jennifer,
yeah.
were you gonna say something? Sorry, were you done, Jean?
Yeah, no, I was gonna say exactly that. I got to moderate for that one, so it also was a happy accident how I got to moderate, and I wasn't familiar with that topic at all. But behind the scenes, Jean and Leah and I had some conversations around how they hadn't even considered highlighting the aspects of how being misdiagnosed or not having a provider recognize the presence of lymphedema and lipedema leads providers to obviously push weight loss, which then promotes some disordered
Hi,
eating.
Mackenzie.
So I know Jean had said that she was going to reach out and see if that was another point of collaboration that we could do in the future, or maybe she's someone we could bring in for a webinar. And we just got the grades. I forget the word, the
Like the reviews,
Yes, they're like some type of scoring system, and they got almost a perfect score. And the academy was like, we consider a 3.5 to be successful, and it's 3.5 out of 5. They almost got a perfect score and everything. Yeah.
that's awesome.
Is there a way we could see like overall, I mean, probably have to ask Elise what the scores were for the um sessions that were part of the eating disorder track? Because I know people were pretty excited about having that new track this year. And I did attend one that was awful on that track, and then there were some that were all right.
Yeah, I only attended one that was eating disorder. And I liked the inclusion of other disciplines, but I also felt like because there was two other disciplines, it was too like they were trying to cram too much into it. I don't know who else, Jean and Teresa, y'all were both at that one, right? And I think
Yeah,
Anna was there.
I really liked the binge eating disorder one. I
Mhm.
am someone who like I like to get a lot of info in a short period of time. So I like that, but I do think for some it could be, yeah, it definitely could be a lot. I think because a lot of it was also review for me too.
Mhm.
But I think they did a fabulous job and I liked their graphics. I took
They
pictures
were
Graphics were
of many
good.
of
they
their
were good.
graphics.
Their personalities were really good. I almost was wishing that I had heard more from the doctor and the therapist. But again, like you said, it was, it was a lot of reviews. So I felt like I would have gotten more out of emphasizing them more. But obviously it's a thing for
Well,
dietitians, right? So
I I would say I'm not involved in that much. I picked like I'm waiting for the recordings because I want to go back and listen to them again. I felt like I was very distracted during that talk for whatever reason.
oh, me
And
too. Well, y'all heard my story.
yeah,
My
yeah,
lack of medications for that session. So that could be why I
yeah,
felt like it was a lot, is because I had,
I
much
I
as
was,
usual.
I would for whatever reason I wasn't as focused as I normally would like to be, and so I need to hear that again. Um, and this I've been back to the slides for the lymphedema multiple times, and um, anyway, it was extremely interesting. And also, like Jennifer was saying, I think many people get misdiagnosed. Um, in, and it's very frightening. Like if your legs become swollen, you might think that you have congestive heart failure or something else. Or you might tell somebody you must just be having too much sodium. Like it's very easy to ascribe it to something that and be incorrect. So again, having actual the right information and thinking it through and being able to say, well, this needs to be checked out a little more. I'm not going to just say, oh, this it must be it, or scare somebody and say, oh, you should see a cardiologist. You really need to think it through. And it was very evidence based, and I think it was excellent.
So,
So yeah.
did anybody attend a session that made you kind of rethink a perspective you already had? I think for the most part, we're all so headstrong. I don't know that we would have been able to do that. And I think, like Mackenzie, I didn't attend as many sessions as I thought I was going to, unfortunately. But
Well, I thought about what I would do if I was 20 years younger, but it doesn't help now.
sure. What about any trends? Did anybody see anything? I mean, obviously the ED track was a huge difference, but um, did anybody notice any other trends, either like in talking to people or types of sessions or anything like that?
I just think mental health in general, it
Mhm.
continues to be a trend. I think it'll continue to be a trend in our country until some very important things settle. And I just think people are interested in it, honestly, personally and professionally. I
Yeah.
would say 50% of the people who I talked to at the BHN booth at the showcase were grabbing stickers that resonated with them, that wanted to know what BHN offered, and wow, that actually resonates with me. So I wonder if the future of BHN would somehow include a little cohort of dietitians who want to talk about eating disorders and mental health for them, like just something separate from the provider
How to help
patient.
your clients. Yeah.
Yeah. But I know that that's quite the task. There's just so
I think so.
wish
And
list, go on.
that was going to be my only thing is I noticed a lot more people talking about mental health, even if the presentation wasn't focused on that. But even more to highlight that when I started my private practice, and I decided to niche into depression, anxiety, and specific, I couldn't find anybody that was talking about. And granted, you get into circles and you learn more and stuff like that, but nobody I felt like was actually talking about there was actually research behind it. There was actually, and honestly, as I say that, not nobody. There is a doctor that I don't particularly care for her message. She was the only one I heard talking about it. And she got in front of a group of NAMI people and told them that they ate blueberries, their depression would get better. But tell me and just tell somebody to eat blueberries every day. And she said, anyways, that was all I was hearing messaging. And now I hear it from a lot of, granted, I am obviously more involved with BHN. So I'm immersed in it more, but I hear it more outside. Sorry, I'm getting a phone call. Sorry. I don't know if y'all could hear that or not. But I'm hearing it more from, like I said, outside perspectives and stuff like that too. Okay, now I think I'm done with the phone call. Sorry. I don't know. Does anybody else see any of that? Even just where I am at the time, and I'm not an eating disorder specialist, but there weren't any eating disorder specialists in Denton. Once we got outside of Dallas, there wasn't really any. And there's, unfortunately, in some cases, circumstances kind of force people into creating practices, but we do have more options now. Even just, I don't know, more and more I see that talked about. So I don't know if y'all are seeing that where you are. We have a lot. I just saw something else is cutting mental health support in Texas again. I can't remember what it was, but that's par for the course here. But we've, got to hopefully having some more pushback and stuff like that. But like you said, there's got to be some stuff put into place.
Can I just mention the MIG, the Dietitians with Disabilities MIG I mentioned before. So they've put together this book, and different dietitians are telling their stories about their so they are sharing their disability, but they're also sharing what they went through in order to get accommodations and make it to pass the RD exam and work in this field. So I don't know, Jennifer, when you were talking about dietitians also expressing interest in their own story, mental health story, I think it's valid because I think I think it's good. It's important, and I think this work that this MIG is doing is extremely important. I don't think anybody has done it. How do we approach being a dietitian when you have bipolar? I don't know. Just some interesting ideas.
Yeah. I wonder if I don't know, for office hours, maybe for office hours, maybe for a webinar would be burnout. I mean, I don't know, FNCE burnout, I feel like was a lot for me this year, but yeah, I mean, because we are working with clients that have such a heavy load. Not that other people don't, but I wonder if specifically, addressing your mental health when working with these patients wouldn't be a good educational
And I guess
resource at some point.
the other thing that I don't hear being discussed, but I think it's important, and that's resilience. Helping professionals, people in our roles, we have to have resilience in order to cope, to do the work we do every day, and focus on tools to develop resilience as well as
Yeah, you might have to get with Yara on that and see if that's, I don't know where she is on her planning and stuff for education, but okay. Yeah. Does anybody else have any thoughts on that? Any whether other trends or to continue this conversation? All
I
right.
think I heard this is my last comment, I promise.
Make as many as you want. That's why we're here.
I don't know if anyone's ever been to like a talk where they talk about temperament and the risk then for eating disorder development. But I went to the talk on uh like body competitions, like form competitions and
Mhm.
bodybuilding competitions. And the presenter highlighted temperament of very detail oriented, can be very high functioning, likes consistency, and then just straight up ignored any questions about eating disorder stuff, which separate issue. But I wonder if temperament is also maybe something to kind of weave into the mix of if you have a client with XYZ or if you function in XYZ, like how best to approach some of these messages so that you're not. And then that's something we could offer to like
Members.
as a resource. Yeah.
Yeah, I've talked about that. I gave a presentation a while ago on concurrent eating disorders and substance use, and there's a lot of they call it, the research that I read called them like personality traits, but like that perfectionist personality trait, the that definitely that might be something, and it's almost a joke on social media about all dietitians are type A and we're all perfectionists and that kind of thing. I don't if that's a personality that gets drawn to the field more because of that same reason, or yeah. Okay. I think most of the questions that I had prepared, we kind of chatted. Let's see. Yeah, I think we've got a lot of it with there. So, one of my questions was, what do you think we should focus on next year, for our members? And I don't know if we need to do an encouragement. It's kind of late now though, because proposals are due on the 18th, but having more of either our EC members or just our members in general, just, hey, like we need some more of this. Could you set up, submit a proposal? I think even having a lot of proposals there could at least put the overall umbrella in front of them more often, and highlight the importance of it. Um, yeah. I don't know. Is anybody else submitting a proposal?
I wanted to, but I am just too bogged down to even like scratch the surface of how to do it. I reached out to, I mean, it was obviously for something kind of different, but I reached out to one of my dietitian friends in Vermont who is one of our members, and she was telling me about her like their sustainable food program and how like what I do can impact that. And but then she declined being able to speak because she's not able to have her face or name or media, anything in the media because of her husband's high profile world. So I was like, dang it, why do you have to take that job?
Yeah,
So I don't know. My idea got shot pretty fast because I was like, I need somebody to do it with. And
yeah. Anna, what about you? Do you feel like there was something where we should have had a larger presence, or that, as far as FNCE overall, I know you being an IDD, that's so isolated. We talk about that a lot. If you felt like you were supported, or if there was certain types of sessions or anything like that that would have helped you.
Yeah, I mean, I wish there were some more IDD sessions. Of course, I went to the like inclusive grocery shopping session, but that was more of a physical disability, which is still relevant.
Mhm.
And then there was one of those like little short, it wasn't like a full session, it was like a little short like talk on
The
youth with
spotlight
IDD
session,
or what'd you say?
the spotlight sessions, like the
Yeah,
ones that
spotlight. Yeah, there was like a short one for that just kind of highlighted working with youth with IDD or autism. But it just wasn't quite long enough to really give me, what I was looking for. So I do wish there was maybe a track more geared towards that. Um, but otherwise, I mean, I found some sessions to go to and really enjoyed my time,
I wonder if we couldn't pitch, like, instead of an ED track, a behavioral health track. And I mean, we would still have eating disorder sessions in there. How did that come about? Were we talked to at all about it, or they just said, hey, we're doing this, and like they didn't tell us at all? You're muted, Teresa.
I was just saying, I don't know.
Oh, sorry, I thought you were talking.
I don't know either. No.
they had a track like that, like a BHN featured track vibe in 2018. I think it was at Washington. Because I remember that was when Christy Harrison was there, Marcy Evans did a presentation, Jennifer McGurk did a presentation. Like they had a lot of different aspects covered. It was a bit more eating disorder and haze focused, but I don't think it's a new thing. I think it's just a re-implemented thing.
Yeah. I think that if we were able to convince him to do a behavioral health umbrella, it would still be eating disorder heavy, right? Just that's where the just population of our DPG, the bigger numbers are in that eating disorder group, right? But I wonder if that wouldn't open it up to be a little bit more emphasis on some of those smaller ones like IDD, not smaller, but smaller number of people that are specifically working on that, or their main interest and that's all they do, or I say all, but hopefully that made sense what I was saying. But
And maybe not even necessarily like a session, but just maybe like another networking event for IDD dietitians or something, or like a workshop. I don't know. Something along those lines.
a workshop's a good idea. um what was I thinking? I already lost it, never mind. But yeah, we'll have to see. I wish we had, unless somebody did and I just didn't know about it, had some kind of insight into what made them do specific eating disorder without, I don't know. We'll have to see. Yeah. Anybody have any other thoughts? Any other, even if it was like outside of FNCE, did anybody do anything out there in Minnesota that was interesting? No. I was gonna ask about
I was jealous of the people who went to the prince's house, but I didn't have time for that.
yeah. Um, yeah, I saw that a lot. We went to the Mall of America, which was kind of cool. I wouldn't go there for that, like go to Minnesota for that, but it was cool to see it. Um, what about as far as thinking of like other educational stuff, I think that a lot of people are still really confused and like what is behavioral health and what is mental health and what is, like, I wonder if there's not some type of education, even if it's like a that level 1 that could be put on, or even like a spotlight or a learning lounge or something like that that could be put on about like what exactly falls under behavioral health, where the distinct that kind of stuff is.
We're kind of trying to do that. So we're updating the standards of practice paper for mental health and substance use disorder. We're changing addictions to substance use disorder for the first time in this revision. And there's a graphic. And right now, I think it's a pretty poor graphic, but it basically just says like mental health, substance use, and then like maybe 2 other things, which doesn't paint the picture. And so we're hoping to update that graphic to be a little bit more of a tree of like behavioral health, mental health, substance use disorder, highlight what the document's going to talk about, but show better how it fits in the bigger picture of like behavioral health. So hopefully that gets approved. We'll run it through the focus group too.
Like maybe more targeted from our logo, right? Our logo has a lot of that on there too. Okay. Yeah. Does anybody have any other thoughts or takeaways? I feel like mostly we were talking about like positives, and I don't want to push like a negative conversation, but like you're welcome to share if there was something that you felt like we could have improved or FNCE in general could have improved. I did see a lot more babies this year. I don't know if y'all noticed that or not, but it seemed like when little Alice was walking around, there was a lot more of those. And I saw teeny tiny, somebody had their little newborn. And I feel like FNCE has gotten much more helpful than it was in Florida when I had Alice there with me. But yeah, I don't know if that's going to be a thing that continues or not, but it was fun to see them. All right. Oh, well, what about the expo? What was your takeaway about the expo? Anybody? I felt like it was very overwhelming this year. I don't like just sensory, like I don't remember, like I've left because I had somewhere to be and then come back later, but like this year I had to leave because it was like it was just a lot. It was too much. Like I I don't know if it's just like I said, my perception is that it was a lot um bigger, but I just like it was loud, I thought this year.
It was very overwhelming. I would the same thing. Like I mean, I know that you know, they have, digital maps. You could try to map out where you want to go, but when you actually get in there and are all overwhelmed, it's really hard to see where you wanted to go in the first place. I wish they more sectioned it out from the type of vendor they are versus like spread them all around, which I know they do that because they don't all competitors don't want to be all close to each other, but
Sure.
it was it was a
That would make
lot.
an interesting expo though, right? We could have all of like the drinks, like the the drink supplements all in one spot and all of the like probiotic people all in one spot and just kind of
A lot
let
of
them go at
probiotic
it.
people, man.
Yeah, I agree. I feel like they should section it out just because it's like there were certain things I was looking for and it was so overwhelming where it's like, oh, I don't think I can even like open my app to figure out where to go. 'Cause it's like you have people handing you food and flyers and scanning your badge. And it's like, oh my gosh. Yeah, so overwhelming, but still a lot of fun, but definitely difficult to navigate.
Yeah, I think that Kendall's right though. They probably won't do that. As much as it would be maybe helpful if you wanted to go look at a bunch of GI stuff. But yeah, you don't want them talking over, pulling people away from somebody else's booth. I think that would get worse, even though the layout might be easier.
I was just surprised how big it was. I didn't. I mean, I've only been one other time, but that expo was just enormous in my
I
opinion. I mean, that's not a bad thing. It's amazing that many
that many people are interested.
brands want to be in front of dietitians.
Hi, team. Um, yeah, I heard from I think it was mostly Sharon and Julia that had mentioned how much smaller FNCE had been since it came back. So I wonder if this is more just getting back to normal and or I haven't been there, I don't really have a lot of perspective obviously on that, but I'd heard that they were bigger in the past. So
Yeah, I think it just reflects the overall concern of the academy for low membership.
sure.
I think it's just reflective of that. But I am seeing an uptake of people coming to the academy. It's acute, and I don't know if it'll last, but WIND shut down that WIND weight inclusive nutrition dietetics group. And I saw a lot of them at FNCE who were previously at that conference. I also saw some anti-academy people in the past present at FNCE this past year, which I thought was very surprising. I also know two anti-FNCE people who were actually at the expo with like a sponsor. And I think when I spoke to them, they were thinking about joining the academy again. So whatever they're doing right now, perhaps they should continue because at least on my end, I'm seeing a little bit of like an uptake.
That's interesting. We need to figure out how to funnel them to us.
That's fine.
Awesome. Well, we are down quite a few people, but yeah, do y'all have any other thoughts or questions or anything like that?
As far as other conferences, because I know doesn't like Today's Dietitian have a conference or something?
They do. I saw the advertisement at FNCE sign up while you were there for theirs. I can't remember where it was going.
Yeah, I've never been to any of those or I don't know how many others there are, but I was wondering if any of you all have been to any that you enjoy or no.
I've
I
been to
haven't, no.
Texas
I know
Dietetic
that
Association
I've
one.
been to the state ones, which are great. I submitted a talk not for FNCE, but for Canned, their conference next year in April. So like the state academy conferences are pretty good, I would say. They have a ton of CE events. Today's dietitian isn't my favorite. I don't know how y'all feel, but I do think their articles are a little clickbaity to me. And I feel, I don't know, I don't find them super, I don't know. They're not my wheelhouse anymore, I feel like, or a place I go to.
I don't know. I don't think I pay that much attention to them, honestly. They'll show up when I'm just like trying to Google a reference for a client or something every once in a while, but I don't feel like I've had a strong thought either way towards them.
What about any conferences like maybe within mental or behavioral health? Is there any like anything like that that you guys have been to?
There's the
Um,
IDEP
I don't,
conference
yeah.
if you're in the eating disorders.
Okay.
I think they do it in Palm Springs every year.
Yeah, there is the I'm gonna get it wrong, the International Society for something in Nutritional Psychology Research, I think, something like that. And they do virtual ones. I haven't done it, but they're based out of Australia. So anytime they do stuff, it's like the middle of the night. But I know they do one. I haven't attended it. Actually, I don't even pay for a membership anymore. I keep meaning to up that. And then there's oh, I just saw it on LinkedIn. LinkedIn might be a good spot for you to start just like hearing about things.
Yeah.
Uh,
Yeah, I'll do some searching on there. I'm just kind of curious, honestly.
mhm. Seems like a lot of GI conferences in relation to mental health have been going on lately.
Oh,
And I say conference, it could just be, an intense like 4 hour thing. Is it lifestyle medicine? LSI life. I don't know. If I could think of it, Anna, I'll tag you.
oh,
They do every once in a while like these 4 hour intensives on different ones. So they did one on gut and they did different types of mental health, but one of them was on traumatic brain injury
oh.
and probiotics, which was interesting. So there's things like that that can pop up. I get a lot of email lists from different places and I don't attend all of them, but they're there. That Nerva app that I mentioned earlier, they do CEUs every so often as well, but not
I think
not
I
like
got an email
conference.
about that. Was that like through Dietitian Connection
Yeah,
recently?
yeah, yeah. I saw that they were, I think they sponsored their email or something like that, is what I gathered from that. I didn't look at it that closely, but
Yeah.
it's a cool resource. I'm really liking it for GI stuff. And it's a lot easier to convince people not to try to do super restrictive FODMAP diets when they have the Nerva app and
Yeah, that's interesting.
All right, awesome. Well, thank you guys for coming. We're gonna go ahead and close it out, and I'll get the information up about when the recording goes out later on, maybe today, maybe tomorrow. So awesome. Thanks everybody for participating.
Yeah,
Thanks.
thanks
Nice
for
chatting with
posting.
you again, Anna. I remember chatting with you at the dinner. I'm so glad you hopped on.
Yeah, happy to be here.
Bye, guys.
All right,
Bye.
bye.